Greetings. This is Jon Lundberg, President and CEO at Ebenezer. Today, I'm at one of our newest communities, the Pillars of Prospect Park, located near the University of Minnesota campus. I'm here today to share with you the latest news and updates related to Ebenezer's COVID-19 actions and strategies. As you'll recall, last March, Minnesota's long-term care and assisted living communities began restricting visitors and quarantining residents in response to the emerging COVID-19 pandemic. At that time, the seasonal flu remained active, and as such, at Ebenezer, we had our usual infection prevention procedures in place. So with additional guidance from leading infection preventionist at mHealth Fairview, Ebenezer was able to quickly adapt our infection control procedures, institute strict screening and personal protective equipment protocols, and implement critical testing for residents and staff. Supported by a strong supply chain for personal protective equipment and expertise from disease control experts at Fairview, Ebenezer has been able to meet the challenge of this unprecedented pandemic. From the beginning, Ebenezer has worked closely with our team as well as experts at mHealth Fairview to stop the spread of this virus. However, this is only part of the story. From day one, our dedicated staff has worked diligently to protect the vulnerable populations we serve, continually wearing face masks, face shields, and making sure to maintain sanitizing protocols and social distancing. Both our staff and residents have demonstrated true grit during these uncertain times and deserve a lot of credit in our fight against COVID-19. While many communities throughout the nation reported high numbers of cases, to date, Ebenezer has maintained an infection rate that is significantly lower than the general infection rate in Minnesota, which is currently at 5%. While we are proud of these numbers, we realize the fight is not over yet. Acknowledging the unpredictability of COVID-19, Ebenezer has adopted a program of surveillance testing for our residents and staff to stop an outbreak before it happens. This surveillance approach randomly tests 20% of staff in each Ebenezer community on a weekly basis and 20% of residents every other week. This strategy has shown that while the disease is devastating to some, others may exhibit few, if any, symptoms, and thus are more likely to unknowingly spread the virus. Testing is critical to getting this disease in check, and the information we are learning is helping us to understand how best to stop the spread. One of the most difficult effects of this pandemic has been the need to implement strict visiting restrictions to minimize exposure of residents to the virus. With new cases of COVID-19 in Ebenezer communities on the decline, we have turned our attention to getting our buildings reopened and reuniting our residents with their beloved families. To that end, the first phase of this reopening has been to allow families to have outdoor visits with their loved ones who live in Ebenezer communities. The response has been very positive, and we are looking forward to continuing to see families. Within our communities, we have begun to allow group activities for residents. While we maintain masks and social distancing and limit group sizes, we are happy to see residents interacting and building social connections with each other once again. We have also begun reopening our on-site beauty salons, and many of our communities have reopened their fitness centers for residents to use. Again, masking procedures and infection control protocols are being closely followed, and staff are diligently disinfecting all equipment and other surfaces between use to ensure safety. Soon, we will be reopening the dining rooms on a limited basis. Our new communal dining plan is to seat fewer people per meal service while increasing the number of dining sessions. Perhaps the best news that we have received is from the Minnesota Department of Health. Recently, we have been given the go-ahead to allow essential caregivers back into our communities. To ensure that we are reopening as safely as possible, we will introduce the Essential Caregiver Program in 3 phases. Phase 1 will allow visits from essential caregivers who provided regular care and support to the resident prior to the pandemic. Phase 2 will allow essential caregivers who provided or will provide psychosocial support for the resident to visit regularly. Phase 3 will include those who were not previously essential caregivers, but who would like to be considered within the new guidelines to be allowed to visit. All essential caregivers must be screened before entering the building and must wear masks and face shields at all times. They will have limited access to any area in the building other than the apartment of the person they are visiting. We are currently implementing Phase 1 in all of our buildings that have been free of COVID-19 infections of residents or staff for at least 2 weeks. If an outbreak occurs in the community, it may be necessary for us to pause this program. One additional way we can minimize the spread of COVID-19 in congregate living settings like nursing homes and assisted living is to slow the spread in the community in general. This is something we can all impact by maintaining social distancing, good hand hygiene, and the consistent use of a face mask anytime we are in public. We are all in this together, and if we continue to practice good safety techniques in all aspects of our lives, it will have an impact on the big picture as well. These have been challenging days for all of us, changing our work and upending all of our normal routines. At Ebenezer, we remain committed to providing the safest communities possible and are working hard to find the right balance between resident safety and normalizing of routines. We thank you for placing your trust in us, and we know that with your help, each of us doing our part, brighter days are truly ahead.